My name is Kapena Kamakavoli. I'm a PA student at the University of Pittsburgh, and I'm going to be performing an abdominal exam on you today. Is it okay if we continue?
Yes.
Before we continue, can I get your name and date of birth, please?
Elizabeth Thomas Gaither, 02/20/2002.
Perfect. I am dressed professionally with my name tag exposed. The patient is on a clean bed with a clean sheet of paper, torn and folded at the edge. I performed hand hygiene prior to interacting with the patient. Now, before we begin, this is the patient's right side of the abdomen, and this is the patient's left side of the abdomen. For the abdominal exam, that would typically be done by just placing the clothes so I can get a clear view of the abdomen with clear natural lighting. For this assignment, I will not be exposing the abdomen. I'm first going to start by, can you have your hands by your side, please? I'm going to inspect the abdomen for its contour, symmetry, any vascular changes, cutaneous changes, any ecchymosis, any edema or swelling. I am then going to auscultate the abdomen, first for bowel sounds in all four quadrants. I am first starting with the right lower quadrant, and then left lower quadrant, and then left upper quadrant, and then right upper quadrant. And then I'm going to listen for hepatic and splenic friction rubs. Take a big deep breath in for me. Good. One more time, big deep breath. Good. And then finally for breweries, I'm going to start first with the aorta, and then renal arteries, and then iliac arteries, and then for femoral arteries. Good. I'm then going to percuss the abdomen in all four quadrants here, noting any dullness or tympany. Perfect. I'm then going to percuss the liver, first by finding the inferior border from the right lower quadrant, working my way up. And I am in mid-clavicular line. Good. And then I will go from mid-clavicular clavicle, working my way down, noting changes there. Okay. And then I would measure with the tape measure the distance there. Perfect. I'm then going to percuss your splenic function here. I am on the left upper quadrant. Take a big deep breath in for me. Good. Good. I am then going to palpate your abdomen just softly, feeling if there is any tenderness or guarding. And then I'm going to go a little bit deeper. I am noting if there is any masses, and if there are any masses, the location, size, shape, fluctuance, the consistency, and if there's any tenderness or pulsations with them. Good. I'm now going to palpate for your inferior border of your liver. This might be a little bit uncomfortable. I'm going with my right hand, my fingers facing superiorly in the right lower quadrant, and working my way up. I'm going to have you take a big deep breath in for me. Good. And then go ahead and relax out. Good. One more time, big deep breath in. Good. And back out. And last one, big deep breath in. Good. And back out. Perfect. I'm feeling for a soft, smooth edge there on the inferior border. I'm now going to try and palpate your spleen here. So I'm going to have you turn just slightly towards me here. Just right there. Good. I'm then going to get my left hand and support your left intercostal margin there. And then I'm going to palpate here. Take a big deep breath in. I am feeling for the inferior pole of the spleen. I should not feel anything normally. Good. Okay. Now I'm going to have you sit up and face me here. I'm going to percuss on the inferior costal margin here. See if there's any tenderness. I'm palpating or percussing with my ulnar side of my hand. Any tenderness there? Perfect. Now that concludes our abdominal exam today. I ensure that the patient is adequately dressed after the exam. I perform hand hygiene prior to leaving the room. Thank the patient for their time and leave the room.